Welcome to the Stay at Home Nurse Podcast. I'm your host, Deanna Cooper Gillingham. For over 25 years, I've strived to use my nurse credentials to find work that fit my lifestyle. Whether it was raising my 4 children and 3 fur babies, traveling the world, or moving to Mexico and living on the Caribbean Sea. Sometimes I succeeded, and sometimes I failed, but I always learned from the experience. Now, I want to help you by sharing what worked and what didn't work. There are so many opportunities out there for nurses today. The Stay at Home Nurse Podcast will inspire and equip you to have a nursing career that is meaningful and supports your lifestyle. Now let's get started. Hello and welcome to this week's episode of the Stay at Home Nurse Podcast. In recent weeks, we've all seen how quickly our work and our world can change. As healthcare workers, we all do our part. Some on the front lines, and some at a safe distance. But each one of us has an important role to play in this COVID-19 pandemic. And what our clients need now may be different than what they needed a few short weeks ago. I love to see how people think outside the box and come up with solutions. And when these people and organizations are willing to share their work with others so that more people are helped, it makes me really happy. Last week on episode 10, I shared with you some ideas I had on how you can add value to your organization, even if you're not on the front lines. I'll link to that episode in the show notes. Today, I would like to share how some nurses are doing just that. Rhea, Arias, and Ariel Huhn, RN, MPH, created an assessment tool to screen the vulnerable elderly in their accountable care organization. It was graciously shared in our Case Managers Community Facebook group, and I have permission to share it with you also. This can be modified and used by other organizations to meet the needs of their population. The original purpose of this screening tool is to have outpatient case managers reach out to those 60 and older in an effort to help the front lines. ERs are swamped because of primary care offices that are closed or at capacity. Many people are showing up in the ER due to COVID and non-COVID symptoms, and many are just anxious. After completing the risk assessment, if it is determined that the individual does not need an ER visit, they can be educated and funneled to telemedicine. They can also be directed to resources for food and other basic needs. The recipients of these phone calls are happy to hear that someone is checking in on them and are responsive to completing the assessment. And the case managers are happy too. This is what Rhea had to say about why and how this is being used in her organization. The nCoV-19 risk screening tool and script are available for everyone to use and alter to support your specific population during this health crisis. It is a byproduct of collaboration between myself, Rhea, Arias, and Ariel Huhn. We aspire to help the front lines, inpatient, by playing our role as outpatient case managers and gatekeepers. We believe that we can do our part in preventing the surge of ER visits by connecting patients to telemedicine, managing non-urgent patient symptoms at home, or coordinating food for the elderly or medication refills. Everything can help in a crisis. Our Accountable Care Organization department switched all of our efforts to help those who are most vulnerable, the 60-year-old and up population. I provided training the morning after we finalized the tool. We partnered staff to practice the script so they will sound confident because it is a new territory for us. The day we trained for screening for COVID-19, March 23, 2020, is also the first day that everyone in our department started to work from home, hence technical challenges. However, I explained to the staff that COVID-19 is the most relevant issue and that we'll switch our efforts to help those in dire need. Everyone accepted the challenge and are working as hard as they can to outreach patients. we are helping our medical group to triage patients with symptoms. As to date, patients are very thankful for our check-ins. There are elderlies who just need an ear to listen. Some need food to eat, a medication refill, or simple clarification regarding social distancing. In short, patients are very thankful. It is still a long fight. I can't help and sew a mask because I don't know how to operate a sewing machine, but I can call as many people as I can to pacify their fears or coordinate the most minute things in their care. Rhea, Arias, RN, MSN, CW, CN, CCM. I have included a link to this assessment tool in the show notes. As Rhea said, this can be modified by any organization to meet their organization's needs. I think this tool will become very valuable for so many, and I want to thank her as well as her organization for allowing it to be shared with as many people as possible. We're all in this together. I hope this inspired you. I hope this week's episode, episode 11, and last week's episode, episode 10, will inspire you to think outside the box. Everybody has a role to play in this, even if you're not working in the front line. Don't think because you cannot work on the front lines that you cannot play an important role. And to those of you that are in the front lines, I want to just express my deepest appreciation for what you're doing. I can't imagine what you're facing every day, but I am so grateful for those of you who are going out there every day and facing the challenges head on. And if you have a story like Rhea's, I would love to hear it. Please send it to hello@thestayathomenurse.com. We love to hear from you.